Hello, everyone, and thank you for joining today's discussion. My name is Dr. Mike Mousseau, and I'm the National Practice Leader for Physical and Emotional Wellbeing Consulting at Gallagher. My role really focuses on designing and integrating well-being initiatives, including mental health and psychological safety strategies all across Canada in partnership with our clients. My background, I have a PhD in behavioral neuroscience, so today's conversation is particularly interesting to me. I'll try to shed some light on some of the human behaviors and throughout these specific discussions. In my opinion, employee well-being is all about behavioral change. So I look forward to all the panelists' approaches to encompassing this topic. So while people kind of join and get ready and settled in for today's event, I just want to do a quick little icebreaker question so we can get to know each other, but also get familiar with the chat conversation or chat feature as well. So my icebreaker question today is, what is one routine or hack or tactic that you use that has really helped your well-being over the course of the past years or months? So speakers, I hope you're listening as well, because I might be tasking you with the exact same thing when we do your introductions as well. I'll start though. So my little tactic or hack as a whole is I write everything down. Everything goes on notepads. I'm making lists constantly. What I find though is the best way is to make a list before I close my laptop for the evening for the next day. What this really does is it gives myself about 5 minutes to think of my day tomorrow, prioritize tasks, write them down, and it really frees up my brain for the evening with my family. So how about everybody else? I would love to hear it in the chat or see it in the chat as we start today's discussion. All right. Thanks, everyone. Let's get started. I'm so privileged to be here today to explore some of the latest research from Dialogue's latest research. My background in being in research myself, I've always loved discussing and finding these studies with my peers and, of course, these panelists today. The specific survey was actually quite unique in nature, as it doesn't ask exactly for employer sentiment. What it was asking for was more the employee's perspective on well-being as a whole. They went directly to the source. They wanted the employee's sentiment and analysis from them, surveying over 1,500 employees across all demographics and provinces all over Canada. This is one of the most robust well-being surveys of its kind that I've ever seen. The goal was to better understand employees' well-being and challenges and perspectives in today's workplace. And some of the key features of this study were, to absolutely nobody's surprise, I think, on this call today, talent attraction, retention, and other staffing issues remains the biggest HR challenge in 2023. And we'll discuss some of those issues today. HR leaders and Canadians agree that organizations' current mental health offerings benefits are somewhat insufficient, but there's growing interest in a lot of these self-led mental health tools, right? These ties into that behavior change phenomenon that we'll get into also later in today's discussion. Leaders continue to face barriers when it comes to adopting better benefits internally for their organizations, like C-suite buy-in, tight budgets, inability to measure outcomes. Well-being is no longer, though, this grassroots up initiative in organizations. We need the leaders to show the path to some extent to make sure that it is okay to be taking care of ourselves at work. And finally, Canadians don't have the time or budget to put well-being first, and they are ultimately turning to their employers more and more for this support. So if you haven't read the report yet, you can download it now. You should see a pop-up on the screen to do so as you go through. So as we said, we have some great panelists here today, and we're going to start to get to know them a little bit better and introduce them. And enough of me talking, so let's turn it over to the panelists to introduce themselves. And I also want to know, prioritize what well-being priority that you are also going to use or tactic that you've been using in the past. So Dave, I'm going to turn it over to you to introduce yourself
Thanks
first.
very much, and thanks for everybody for joining us today. My name is Dave Tuck. I'm the Director of Human Resources, concentrating in compensation and benefits for the law firm of Osler, Hoskin and Harcourt. Osler, Hoskin and Harcourt is probably Canada's preeminent business law firm. We have offices Montreal, Ottawa, Toronto, Calgary, and Vancouver, and New York. Roughly 1,200 employees, probably about 450 lawyers in total. and I'm responsible for all of their benefit programs as well as their comp programs as well. So trying to attract, retain, engage our staff. In terms of my wellness hack, Dr. Mike, about 6 months ago, we got a dog, and that's been really beneficial for me because it forces me to get up and get out. And because if I don't move, she reminds me to step away from the computer and we got to go. So, and I see based on the chat today, I'm not alone in that concept of getting out and even for a few minutes, walking in nature and enjoying some of the benefits that brings as well.
That's great. Thanks, Dave. Heidi, over to you.
Good morning. I'm Heidi Flynn. Thank you so very much for having me join you as part of the panel, and welcome to everyone. Before I share my point, I wanted to say I was reading the chat and Sam mentioned meeting with your team every morning and sharing a moment of gratitude, and I love that. I might actually steal that. Apologies, my camera does not want to focus. There we go. So I'm Heidi Flynn, Director of Human Resources for Digital Extremes. We are a video game company that has over 500 employees all over the world. We have moved to a on-site, remote, and hybrid model. So I'm absolutely thrilled to be part of the team. I've been with Digital Extremes for over 10 years now. My personal point that I try to focus on is balance and boundaries. So setting, balance not only for myself, but for the team, but, also boundaries of, at the end of the day, not shifting from my office at home to the couch and taking my laptop and kind of sneaking that in during family time. So really critical for me to focus on that.
Oh, thanks so much, Heidi. Sylvain, turn it over to you.
Thank you, Dr. Mike, and thank you everyone for joining. This is quite a thrilling panel to be a part of. So I'm Sylvain Beauséjour. I have the privilege of leading the talent and culture team at Dialogue. And our mission as a company is to improve help people improve their well-being. It's a great passion of mine to be here today. And what I do, and I think some ideas came up in terms of walks, definitely blocking calendars. It's a great idea as well, so you're not stuck in meetings back to back, but save some time for yourself. But what I like doing is connecting to music, listening to it, and also playing it, or I should say, trying to play music. So that helps me preserve some sanity at the end of the day.
Awesome. Thank you, Sylvain. And last but certainly not least, Stephanie, over to you.
Hi, so I'm Dr. Stephanie. I'm the Associate Medical Director at Dialogue, working with Sylvain. So I'm a family physician based out of Montreal. So I work part-time with my own practice and then part-time with Dialogue. My own health hack, I think what I struggle with the most is definitely moving during the day. A lot of what I do is seated, even through medicine. A lot of it is done sitting down. So just finding small moments in my day that I can use to move as opposed to just trying to do one big activity during the week. So sometimes between patients, I'll get up, I'll put on a song, I'll move. Or also just what's called habit stacking, which is when you take something that you're already doing regularly and then just adding on another action that you would want to do right after. So, like 10 jumping jacks every time you finish brushing your teeth. And so that's also found just ways of making things a bit more regular in my schedule.
Awesome. Thank you so much. And thank you for your introductions, everybody. So without further ado, let's get started and let's get into some of these questions for today. So, like we mentioned right off the top, leading HR issues continues to be talent attraction, retention in 2023. But employee mental health is a very close second. This makes me stop and think, could these issues be connected in some way, shape, or form together? So I guess my question to the panel is, how do we think about the three different layers or factors of well-being, right? Physical, emotional, and financial well-being. How are they affecting talent attraction and retention these days? So I'm going to start with you, Dave, on this question.
Thank you. From my perspective, attracting, retaining, engaging, inspiring our employees is one of the things that we as a firm aspire to do. And I think that having, great benefit programs, systems, feelings, support for all of our individuals will make that difference. If we don't do something, somebody else, one of our competitors will. And the cost of attraction of individuals, the cost of absenteeism, the cost of presenteeism is outrageously expensive. And in order to succeed as an organization, we have to combine all of our programs, have a sense and a strategy around them that will make it easier and simpler and better and faster for us to attract and retain our staff.
Yeah, thanks, Dave. Someone else will. I kind of like that line there, and it is true, right? There's a war on talent, and if we're not keeping it up, then that will happen as well. Heidi, I'm going to turn it over to you and kind of explore this from your lens as well.
Yeah, thank you. I think, as we all know, the global landscape for recruitment has changed drastically. The questions that we used to get from candidates before really focused on, compensation and particularly their role. And we are seeing a ton of change and a shift in the question around what's your benefit package look like. I find it very interesting when we send off an offer. One of the biggest things, the follow-up question is, can I do a call with you about your benefits plan? And I think that is a game changer for us. And I think it is very unique. I think it's easy for a company to just, forward off their benefit package and say, this is what we have in place. I think what the employees or what candidates are looking for is, I need you to show me that you genuinely care. I need you to show me by demonstrating what you have in place for the company, culturally, your benefits package. I want to see the whole entire offering, and I want you to be able to demonstrate to me how you're going to care for me, my employees, my family, colleagues. So I think it's really a different journey now. And the journey is, for candidates, I need to know that intentionally you are genuine in your caring, and please show that to me. So I think it's definitely a shift that we've seen in the recruitment landscape as of late.
Yeah, that's such a good point, right? It's one thing to kind of say you care, I guess, to your employees, but showing it with these programs and solutions is, I think, the next layer to that as well. Sylvain, I'd love to turn it over to you to get your perspective as well.
It's been well said already. I think the pandemic has greatly influenced, of course, ways of working and had organizations adapt to a very different reality. And I think what we've seen as well is that well-being has grown in importance for employees. And like it's been said by Dave and Heidi, they now have a choice, or maybe more curious to find out what companies offer. So I think for organizations, it's really to reflect on our own value proposition. What is it that we offer that will allow us to show that, yes, indeed, we care by providing the right benefits? Because the employee feels that they have this from the employer, much more likely to be staying for the long run and feeling more engaged and inspired by what the company can offer.
Yeah, thanks. Appreciate it. Stephanie, anything further to add on that one?
No, I think most of what I would want to say has been said. It's, I think something to note is just the way that our system currently works as well. The question is, who's responsible for providing these well-being initiatives? And, employers are particularly well suited. Though the issues we know, it's hard to find services in our current healthcare system. And so it's something that people are looking more and more towards their employers to be able to provide this service and to provide it to all access. So I think it's also an important thing to see that, not only is it a really important factor into, attracting and retaining talent, but it's also what people are expecting from their employers, and which is why they're asking these questions, because it's a need that we need to fill. And the question is, who's the best person to help out with that?
Yeah, that's a really good point. I'm going to ask a follow-up question on this then to the group. It's, I think overall, most Canadians, we want to improve our well-being, right? We want to feel better. We want to, be physically, mentally, and financially more well, right, over time. But half the people don't have the budget or time to really take the action. And much like you just said there, Stephanie, it sounds like there's a need for organizations to almost step up in a way, right? Do you agree? I guess I'll turn it over to Dave first, but do you agree that the onus should be on the organization to do this? And how are organizations kind of stepping up, I guess, with their benefits?
Good question. I'm not sure that I think employees expect it. And because employees expect it, then employers have to do it. It doesn't matter if I agree with the concept or not. I think at the end of the day, we need to, I'll go back to the attraction, retention, engagement. The cost of doing nothing is not sufficient, is not on the table. And I think that you're right. I think people have turned to their employers for greater and greater responsibilities to be able to deliver on programs, to be able to look after them financially and emotionally and physically. And we expect a lot of our employees, don't get me wrong, and they work hard for their total rewards. But, you know, I think, again, if we don't do it, somebody else will. And because of that concept, we have to make sure that we are on the leading edge of you know, engagement activities for our staff and employees.
What about you, Heidi, on that question? You know, yeah, please.
Yeah, absolutely. I was making notes as Dave was talking. I think the key point is we ask a lot of our employees. You know, we ask a lot of time, we ask a lot of effort, passion, and the result of that, stress, you know, at the workplace, stress on your family, stress on your work-life balance. So I do agree. I you know, I'm not sure that it's required or that we, you know, that it's something that I would say is mandatory, but I think we owe it to our employees. You know, if you are asking a lot of your employees, I think the return of care and well-being does become the responsibility of the employer. And, you know, that care and well-being can manifest in many different ways. But it's a longer discussion, but I do think there is some onus on us just to make sure that the well-being and care is there, whatever that looks like for your organization.
Yeah, that's a good point. Sylvain, anything?
Yeah, I think employees have certainly a key role, and benefits as well can play a role as long as they're responding to a specific need. I think the challenge we may have seen in the past, and we see this from the survey where 40% of employees do not use the employee assistance program, I think it's up to the employers as well to raise awareness around what's out there. And I was just curious to see if I was to Google the word well-being with an hyphen, because it could be spelled without the hyphen, there were more than 800 million results. So to be able to direct employees to the tons of resources available, are they all scientifically proven? Maybe not. There's a tons of helpful tools that could be available. I think it's our role to help direct and raise awareness around what's out there to help employees. And you know, lack of time, lack of money. Many of you have said that taking walks is something that works for you. This is at no cost. And if our health is everything, it's up to every one of us as well to prioritize that time and effort.
Yeah, that's such a good point, Sylvain, right? I always say the most difficult part about being a well-being consultant is that everybody's definition of well-being is different. And I think that's something we have to keep top of mind. Stephanie, I turn it over to you. You know, you kind of brought that question on to me. How do you kind of feel about the organizations kind of stepping up in this case?
No, I think step up is a good word. I mean, obviously, not gonna be able to solve every problem that's related. Like, it's a lot much bigger than just, for example, you know, employers and employees and corporate culture. It's the world that we live in, the society that we live in, the healthcare system that we're working with, and just everyone's overall health is involved. I think it's just more a question of everyone doing their part. I really liked, Heidi, how you phrased it in terms of, you know, we're asking a lot, and so in return, this is something that we want to, you know, create a balanced system. I think people tend to think it's all or nothing, and sometimes just the smallest changes will make the biggest difference. We've seen, and even it came out in the survey, people's willingness to seek care for mental health in particular has increased dramatically since the pandemic, since the integration of virtual care, just through talking about it more, sending out initiatives for mental health and just making it seem like something that is normal. We know that just the fact of having, you know, an open environment that you feel safe to talk about something, and even if that's the first step that an employer does, is just make it so it's a safe space that people can talk about it. Make things a little bit easier. And so even just these small steps over the long run are what's going to have the biggest difference over time. So it's not a question of saying we're going to have, you know, the most fully fledged program, but just starting by having, you know, people that are, you know, that understand what mental health is and what wellness is, that apply it themselves. So it's not just something like, here's something we're going to offer you, take care of it, but we're not going to follow that example or that model. It's just figuring out, you know, what works for you, what works for that particular company, and, you know, what type of company are you? What values do you embody? You know, Dialogue, we've set our own, you know, what are our mission values and what do we want to apply across the company, so that everybody, you know, it's a top-down type of thing. So you won't really see change if, you know, that you can have something that can be used, but if people don't want to use it, it's not going to have much of an impact either.
Yeah, that's a great point. Thanks for that, Stephanie. And kind of on that point, I guess, as we push forward in today's conversation, you mentioned there a little bit about resources available. There's a plethora out there, right? Well, there's striking numbers being presented these days in regards to offering the correct resources, and if managers even know the resources available to their people, right? Ultimately, that's where a lot of employees are looking for these supports, is to their managers. Turns out 43% of HR leaders believe their current mental health offerings are insufficient, right? And Canadians kind of agree on this point. Furthermore, though, if you kind of dissect this even deeper, there's also a report that shows that only 43% of HR leaders consider their managers well equipped to even refer employees to mental health resources in the first place, right? So the resources could be there, but it's kind of that learning and education of it to the leaders that is really necessary. So my question is, I'm going to toss this over to you, Heidi, first, but what do you think is kind of preventing leaders from providing adequate support to their employees? And how can employers kind of provide better care and resources and education to these leaders, I guess?
Yeah, it's a fantastic question. I think first and foremost, I think there is a lack of understanding around mental health versus mental wellness, and what does that actually mean? So I think first of all, it's diving into that and understanding what that is. We still to this day struggle with the stigma around mental health, and that is something we're really focusing on at Digital Extremes, is removing that stigma and making it a safe place for people to ask questions or come forward. I think where that ties into with the leaders is ensuring that you are doing training and coaching with them. Ensure that, I think, as you mentioned, Dr. Mark, ensuring they know what resources the company has, what platforms are available. I think there's always an issue where for some managers, they may not want to approach the HR department because that means they're highlighting a concern on their team. So I think there's also mentoring and coaching that, HR leaders can take a step back, take a look at this and build on that relationship with your managers and empower them to manage the situation with the tools and the resources. Because I think quite often managers and HR leaders are looking to solve problems. And so these are the type of things that we do not want our leaders to solve. We have the dialogue platform, we have accredited professionals, we have doctors, nurses right at our fingertips. So instead of us looking at it as this is an issue to solve or that we need to step in and solve it, I think if you can take the time, do the mentoring, do the coaching so that everybody is aligned on providing that safe and secure place where managers feel comfortable owning it and HR does as well. So I think it's really a huge opportunity to do that coaching and mentoring with the leaders and ensure that they are well prepared and feel comfortable as well. That's also key.
Exactly. I think that you hit a good point there. I think gone are the days, right, of employee coming to a manager or vice versa. And then if there's a mental health discussion on the table that the leader says, whoa, this isn't for me, this isn't HR. I think those days are gone, right? We as leaders and managers need to be able to just open the conversation and direct to resources, because what a major hurdle that is for them to even approach you in the first place, right? To give them another hurdle of going to talk to somebody else, I think that's something we as leaders need to kind of mitigate in a sense. Dave, I'd love to turn it over to you and get your opinion on that.
Points on that. I thought Heidi's response was excellent. Even the statistics, we talked about 43% of HR leaders believe their current mental health is insufficient. So that implies that 57% thinks it is sufficient. I'm surprised at that. I think there's a lot of need. Yeah. There's a lot of want. There's a lot of desire. And I honestly believe our leaders want to do a good job. They're just uncomfortable or not used to or not adequately prepared to help their employees in a ways that they think they should be. So to me, and I go back to Heidi's point, education is the key. Support and education. What are the programs you have in place? How do you access it? What kind of things, what kind of situations would inspire you to call this vendor or versus that vendor? When would you talk to EAP? When would you talk to your health provider? When would you talk to different, when would you pick up the phone and talk to dialogue? there are
Yeah.
a lot of different ways, and I think people want to understand when, in what circumstances would I call each of the various vendors that are out there, and how best to supply it too. I mean, COVID has changed a lot, as we talked about. People want stuff 24/7. They want virtual. They want, they want it when they want it too. And it's got to be quick and simple and well prepared. And that's not easy to do. So I will give people all the credit in the world that are trying to pull these programs together. But I think I'll go back to my mantra: if you don't do it, somebody else will, and that'll be the end of your employees.
Yeah, I think upskilling and understanding that we're not there to solve problems as leaders, right? 2 ears, one mouth. We have to remember that we're there to listen, right? Take in and then direct your resources appropriately. Stephanie, I'd love for you to kind of chime in on this and understanding that leadership onus towards directing some of your patients, I guess, to ultimately to resources.
No, and exactly. I've seen kind of both sides of the coin. We have employees that are consulting, we have employers that are consulting, and we get everyone's perspectives. And it's also hard in a business type environment where you're trying to balance being a good people manager, but also performing with work and managing leave of absences and stigma like that. One of the things, at least on the manager side, that can be done. So we talked a lot about just learning what the resources that are available are, but it's also a question of learning, what are signs and symptoms to watch out for? How do you know that someone you're working with is struggling? Are they always missing their deadlines? Are they always calling in late? Sometimes it's just a question of asking and just having that dialogue. Is there something, happening at home? Maybe, they have a child at home who is sick, or they're struggling with ADHD, or they're neurotypical, and just finding a way to make it work for them. So just, opening that conversation with an open mind can sometimes bring a lot more information. And then, not only just recognizing, but being proactive. So putting initiatives in place if we know that, this is a particularly stressful period at work, or when seasonal depression period starts coming up around the fall and our very, warm country, just learning, okay, well, can we implement some, challenges at work to encourage, just check in from time to time, not only just on, individual people, but also just in terms of organizational health. So, have we had a challenge that encourages people to move, to eat well? Are we talking about, implementing meditation, yoga initiatives? So just keeping a pulse kind of on how, the organizational wellness is doing as well. And something that hasn't been touched on yet is making sure that it applies to everybody. And so diversity and inclusion is something that's really important at Dialogue. And I remember when I first started with the company, you could only register on the app as either male or female. And that is already a huge blocker to using the service. And so we worked really hard, even just to kind of let people know why that was really important, that this is a blocker for people even sometimes starting using a service. So figuring out, who do you have as employees? Does it apply to everybody equally? Is it inclusive for BIPOC? Is it inclusive for LGBT? Is it inclusive for women? Is it inclusive for parents and families? And so just making sure that there's a lot of flexibility in terms of what is being offered. And then also in terms of benefits. So, is it flexible enough for people who have children? Are the benefits covering things like, paramedical services for transgender care, integrating elder care with Indigenous care, and just figuring out kind of, does everyone have a seat at the table, and is their voice heard equally?
Yeah, those are fantastic points, Stephanie. I really appreciate that. And Sylvain, I'll kind of give the last word here to you, and anything else that we should go into.
Yeah, great points have been made already. I think we talk about the role of managers. The leaders have such a critical role to play in creating that safe space in their teams. And I fully agree around the raising awareness, education, but also communication is so key. And to have these regular check-in, the one-on-ones that go above and beyond the simple "how are you" type of thing, talk about whether it's how are you really, and to be able, as Stephanie said, to be able to detect the signs that could lead to helping support employees to find the right resources to help them.
That's a really good point too, right? How are you really? And that kind of brings up something in my head that I often kind of portray to leaders when we do a lot of our training is ask twice, right? Too often, hey, Sylvain, how are you doing today? Right? I'm okay. I'm fine. right? That's where that conversation ends, and we never ask again, right? Think about that a day, a week, a month later. Hey, Sylvain, no, I'm actually really would like to know how you feel, right? That second connection point with them might just open up what, for them. So, from the answers here, I think there is, it is a little bit clear to me that maybe there's some stigma still involved, right? That this, Canada as a whole is still working on. I think initiating a supportive conversation, training leaders can really help remove some of the stigma, with almost every organization and leader concerned about mental health, burnout, and all of these factors. Only 17% of organizations train their leaders on discussing mental health issues appropriately in their programs and development issues. So something we all as organizations can kind of think on as we move forward to our next question. So our next question really is going to start to, when investing in employee well-being, right? This is an investment, and the majority of HR leaders expect to see these significant improvements right away, right? Potentially. I often get tasked with designing dashboards, kind of tracking specific key performance indicators, some of which have been quite impactful over the course of a few years now that we've tracked. But when push comes to shove, anecdotal evidence or stories may be just as powerful as tracking an exact dollar amount. So, what are some of the positive changes or powerful stories that your organization's heard thanks to some of the wellness initiatives that you have implemented already? And Heidi, I'll start with you on this.
And thank you. I appreciate that. I think it's well known, my thoughts, even the organization. I love the dashboards. I love the data and the stats. But for me, it's actually being able to look at something or touch something and say, yeah, that's a real story and we've had impact. So twofold for us at Digital Extremes. The positive changes that we've seen. So we were super fortunate to implement dialogue early on in the pandemic. And so the impact on the organization beyond tremendous. Impact on HR to start with was fundamental. So HR was becoming the hub where employees would go to share stories around, I can't attend a funeral, I can't go to the retirement home, I can't go to the hospital with my wife who's giving birth. And so HR was taking this on, and you live and breathe that, and you take that home with you. So, we approached our senior leaders and said, we need to put this in place because we are not trained, equipped, nor should we be providing the guidance. So significant change just to the HR department. And then we move on to the changes that we saw across the organization. There was change in people's behaviors, work-life balance, relationships with their family. I mean, dialogue offers support and guidance on so many different levels, regardless of what your concerns, issues, problems, medical issues are. And so, we saw it across the organization, but we also started to see responses from partners, spouses that had also utilized the platform. So it was very, very rewarding for us to see that the positive changes went beyond just the employees themselves. All of this positive change, of course, then has impacted the productivity, therefore impacts the relationship with their manager, and you just see it multiplying and impacting different levels and different people. So the positive change with the wellness initiatives across the organization has honestly been tremendous.
Yeah, that's a great point, right? There's this old tactic, right? If you want to get somebody to remember something, tell it to them in the sense of a story. They're 20 times more likely to remember it, right? And I think those are the powerful stories that we need to hear and portray from our organization to say, this works, right? Dave, any stories from your lens?
We got lots of good stories, but I'll talk a little bit about that truism that they say that people don't remember what organizations do necessarily, or what organizations say necessarily, but they do remember how they make them feel. And I think part of our success from our wellness initiatives is to making people feel good about themselves, about the organization, that we're there to support people, that we understand that they want to, we want people to bring their true selves to work every day, and that this is a safe and caring environment. And I'm talking about a law firm here, remember that, right? But this is a safe and caring environment, believe it or not. And yeah, we stick up for our own, and we help, and we we don't coddle people, but we support them. And I think there's a difference in that too. And what I'm hoping is that does make people feel good about the organization, that they buy into what we're selling, that they become engaged, and they want to stay. And that's really what we're trying to do with all of our initiatives, especially on the wellness one. Very quick story. Last month, we ran we call a spring into summer wellness challenge. We had an activity every day for somebody to do something. And it's amazing just how the banter amongst staff and lawyers and, jovial sort of joking about, well, you only took 15,000 steps yesterday and I went 20,000. It's just because they're a competitive bunch too. But it creates buzz, it creates excitement, gives people something to talk about, around the elevator and around the water cooler, because we still need that. And I think that's important as well.
Yeah. I mean, emotions are powerful pieces, right? Remember how I feel. I think that's such a great line, but also I think we need that. We can't always be in work, right? Even at work. We need that separation a little bit. We need to rejuvenate our brains. We can't just completely be in it all the time. And I think things like this that allow us to almost recharge our batteries, right, a little bit while we're going through. So, Sylvain, any stories from your lens, whether it be somebody coming to dialogue with a story that you remember, or dialogue specifically?
I can relate to what Dave is sharing around feelings, because to me, what drives employee engagement is a lot about feelings, feeling supported, valued, inspired. And what's been quite inspiring for us setting up our wellness challenges, similarly to your organization, Dave, very competitive bunch, having some walking challenges and doing a virtual walk around the world through some steps we do every day, and combining this with a philanthropy cause, supporting a charitable organization, is a good way to leverage that sense of togetherness, of belonging, and giving back to the community. Something we've done many times, we keep on doing, because it's a great way to combine a couple of great objectives all at once.
So I have a quick follow-up question here. So we know HR struggles with C-suite buy-in in some cases to put these in place, budgets, right? Improving the benefits, all this. Heidi or Dave, I guess I'll come to you, Dave. How did you overcome these barriers and get stakeholders, if you're C-suite or finance, to really see the value in investing in these
Two ways, from my perspective. First is our C-suite understands dollars and cents. They like that's the language of business. They understand that. So you have to first and foremost come with a great business case that outlines, what is the cost of absenteeism. I'll plug for Dialogue. They've got a great model on their website of looking at the number of days somebody's away, what the number of people that they're got, and what the average salary is, and you can calculate the cost. And it's significant for people to be absent. It's significant for people to be present too, and not fully engaged as well. So you can appeal to the C-suite specifically on the cost of dollars and cents. What's the cost of absenteeism versus, introducing this new wellness component, and what the payoff is on the wellness component as well. So certainly appeal to them from their intellectual perspective, and their pocketbook, their wallet is always a good one. But I would also argue that, especially in the area of mental health mental illness really knows no boundaries. It affects the top of the house as much as the bottom of the house. Our lowest paid employees have as many challenges as our top paid employees as well. So it is not class selective. So I think if people start to talk about these things, it's amazing to me of how many stories come out and people start to share, and that just makes them more human as well. So again, I think managers and C-suite certainly want to do a good job. Our job is to try to help them understand what that good job is going to look like and what the value is too.
Yeah, it's such a great point, right? Nobody's immune to these issues, right? It doesn't matter where we are in the organization. I think it's imperative to start telling these stories too from all lenses of the organization. Heidi, quickly, anything to add on that one?
I think Dave covered it beautifully. I think, one of the things that we were able to do was take a look at our old EAP program and look at engagement, what the value that people were getting. And so we actually did a survey. Are we meeting your needs? Have we identified the gaps? Are we, giving the services to the employees that they're looking for? And, there is a ton of resources that Dialogue can help you with to present that back to your organization to demonstrate the value. But for us, it was really looking at the cost of what we were spending on our old EAP program and the extremely low engagement level. So it was very easy for us to be able to justify the cost as an organization for sure.
Awesome. And thanks for those responses, right? The truth is the bottom line will ultimately prevail for a lot of organizations, right? We have to understand the cost of these initiatives, and showing that financial impact is, it's always going to be imperative to make the day-to-day business sense of this, right? But beyond the productivity conversation, benefit utilization, absence, all these things, turnover numbers that we've talked about already today, and we're tracking as organizations, it's my belief that it's the right thing to do is a very powerful metric at an organization. Full-time employees spend most of their waking hours at work these days, right? The workplace is, in my opinion, the ideal place to reduce community impact of mental illness and help people thrive, not just at work, but at home and in communities and throughout Canada as a whole. So I think that's an imperative as well. All right, we're going to move on. So we've discussed why prioritizing employee well-being is the right thing to do, right? We talked about that a lot in the last question, but what are some of the risks? And Dave, I'm going to flip this to you first. What are some of the risks in not offering the right benefits to your employees?
And again, I sound a bit like a broken record, but in my opinion, if the cost of doing nothing is significant, it doesn't work. We have to be able to present programs that engage our staff, attract our staff, reward our staff, recognize our staff, and then their families as well. We haven't talked a lot about that, but all of our programs also apply to all of their dependents as well, which I'm really pleased with, because people don't, you don't leave yourself at the front door of the office building and then pick it up on the way out. You carry yourself all through the day, and that includes, your family, your relatives, your friends, like all of it, whoever you're bringing with you too. So, by not doing the right things, people will go elsewhere to find places that will support them, make them feel good, make them feel valued, are consistent with what their mental, emotional, physical, psychological needs are. And I think that's one of the things that we strive to do. Can you be everything to all people? I don't think so. But you can make it available. They can make the systems available, make the programs available, make the support available to capture the biggest group that you're trying to attract and retain and engage.
Yeah, there's two things you hit on there, right? And Heidi, you hit it on your last answer as well. Is what are the employees actually asking for? I think that's something we need to make sure that that's top of mind. And the other point is, and you hit on this in this one, Dave, is these initiatives cost money, but ignoring them costs way more downstream. And I think that's something we got to keep top of mind as if we talk about risks of not offering this to organizations, right? Heidi, I'd love for you to expand on that as well.
Yeah, absolutely. And I actually want to reference a point that Lindsay made in our chat, talking about seeing the upcoming generations in the workforce where they're asking for things that will undermine the integrity of work. So it currently is an employee's world, right? It's an employee's world and choice in terms of the amount of offers they're getting, what the landscape looks like. And so I think, as we've all mentioned, Dr. Mark, you said it's the right thing to do. And Dave, in terms of retention and attraction, people are going to be going elsewhere. If people have high expectation, which they should and they do. If you're not offering the benefits that fulfills their needs and you can't offer it, they will move. They will go somewhere else. It has really become incredible value to be able to demonstrate that to employees. I think I go back to in the beginning where I said you need to be intentional and strategic with your care and be genuine in your care. So the risk of not having these things in place can be tied back to the employee feeling, well, you're not actually genuine in your care. You're saying you are, but you need to be able to demonstrate it to me. So I think the biggest risk is not being genuine in your intentions of what you're looking to offer the organization and the employees.
Oh, that's such a good point, right? Asking what the employees are looking for and ensuring that we're not just kind of being attracted to what the squeaky wheel is asking for, right? I think that's also something that we need to keep top of mind as well. Stephanie, I would love to, come from your lens here on this as well.
No, absolutely. And I would say one of the things that, we haven't really touched on too, is just how different the world is since the pandemic with, the change in how people are working, how they're connecting to their colleagues, how they're, working from home. Initially, it was almost, other than essential workers, it was all from home. And so even things that, were considered, people who had made, specific requests to have, maybe be able to work from home more often. And we're saying, no, this is not possible. Well, now we've put things to the test, the way that, we structure how we work and how we interact with colleagues. I think we're finding the balance tends to be the best place. We know that entirely working from home tends to be detrimental to a certain point of time if, you don't get to, I'd mentioned, social interactions. So how do you find ways to communicate with colleagues? Sometimes we're spread out across, the country or across continents, if you've got different wellness challenges that can bring people together. And then also just counterbalancing, sitting at home, if you're working from a computer, integrating physical activity in your day. We saw a lot of sedentarity since the pandemic as well, where some people, the space between their bed, they had done one survey, and the space between their workstation and their bed was 16 steps. And most people were staying pretty much well under 1,000 steps during the day. So just also adapting to new realities, to new generations, different ways people are using to, to connect with their employer. And we're no longer, we've long passed the point where employees and employers are separate. Employees are a vital part of an organization. So you need to take care of everybody that's within a particular organization. And we've seen, for example, they've done these survey models on, should we only target, the people who are the most affected, the people who are the most suffering? And it's actually offering benefits to everyone at all levels of risk that has the biggest impact. Even just thinking, let's say one person is struggling in terms of productivity. Well, everybody else on the team maybe is now working 120% to catch up. And then one person is having a harder time. And so maybe they go on leave, and then all the other people who are left have to work a little bit harder. And so it does have this, streamline effect on everybody that's working. And so taking care of everybody is really important. And also just the organization themselves, making sure that people that are in positions of leadership recognize themselves too if they're struggling. It's even more stigmatized the higher up you go sometimes in organizations. And it's just finding ways that, someone had mentioned in the conversation, talking about your own experiences is also a really important way to open the door and make something seem like it's normal, which it is.
Yeah, it is. Yeah, absolutely. That's a great point. It is normal, right? Like we talked about earlier, that nobody's immune to these issues and these across all generations. So Sylvain, I'll give you quickly the last word on this one and before we go into our Q&A session. And please, everybody put some questions in the chat, and we'll be sure to hit them on the next.
Yeah, very quickly, Dr. Mike, it's really linked to what Stephanie just mentioned and a comment from Shauna as well about sharing our own experience. It's just not the benefits themselves, it's also creating the safe space where it's okay to talk about our challenges. What we've done at Dialogue, which was quite striking to me, is have several. First of all, we have patients' testimonials on how they appreciate the service we provide. We also have some of our own employees tell their own story. And I've seen that during kickoff events where people were coming very vulnerable around the situation, the struggles they had. And I've rarely seen colleagues standing up for innovation to recognize the fact that someone was vulnerable, telling their story, to make it okay to talk about challenges they've had and how they overcame these obstacles. So we'd encourage everyone to find ways to create that space where it's okay to have these important conversations.
Yeah, it's okay to not be okay, right? And I think that's something we got to keep top of mind here. And back to the first topic of today's conversation, attracting and retaining employees is number one, right? HR issue. I think we can all agree with that. The younger generation, though, this generation that's coming up, the one that we are trying to attract and retain at higher rates, these are the ones we really need to focus on with a lot of these as well, right? We can't lose focus of any generation in this. But the fact is, 20% of people left their jobs last year because of mental health concerns. 75% of those were in the Gen Z population, right? So we have to keep this focus on that younger generation and understand that, they are the ones that are really, really in need of a lot of these supports, much like everybody else in this organization.
Dr. Mike, I read
All right.
a study just this morning,
Dave,
which I thought was really interesting, was that 50% of all long-term disability claims for people between the ages of 18 and 35 are from mental health reasons. 50%. So, and I'm always amazed by that, because you would think they're young, they've got their whole lives in front of them. They've got nothing but great things to look forward to. And yet the statistics are that high. So you're right. We need to be able to address that group in particular and try to provide supports targeted to that category in terms of how we can help them and get them back to work and get them engaged and get them working hard.
There's a study that shows the average age of disability in Canada is about 45. The average age that disability ultimately starts to affect their productivity as a whole, or just them as a person, is 32, right? 13-year delta of suboptimal performance in some cases, right? So top of mind, younger generation. This has been great. Thank you for all your insights and really understanding this. Is clear organizations are prioritizing employee well-being, and we're going to see this successfully cascade through a lot of different organizations, right? I'm going to turn it into the Q&A session now. And please, if there's any questions, please put them in the chat. But there's already a couple that have come up that I would love to get people's points of view on. And I think on this first one, I'm going to actually ask Stephanie to take a shot at this, and then I'll ask our other guests as well. But is anyone aware of any benefits programs that include support or testing for neurodiverse individuals? And Stephanie, you brought this up a little bit earlier, but are you aware of any of those within the workplace?
It really depends. I would say the first step is just kind of knowing how to go about getting these, getting an assessment for neurodiversity. Usually these are done through either psychologists or neuropsychologists. And so there's, we're talking about EAP programs. Generally, the therapists that will be part of EAP programs will not be the ones to do those assessments, but they might be able to, initiate the conversation for someone that, is having questions about something and say, okay, I do think it's worth getting a more formal assessment. And they're usually things that are covered. It's very hard, unfortunately, in the public system. And, children and adults alike, they're slightly different, at least in Quebec. Where I work, everything is kind of sectored by where you live. And so if you're lucky and through your local resource, they have, you can kind of go on a wait list for the public system. They tend to be very long. But if you have an employer and you've got a private insurance that's associated, most of the time they will cover either psychologist or neuropsychology assessment. So, every organization kind of needs to see, okay, well, what is covered, in terms of assessment. It's really important that the benefits that I'd mentioned that are covered are inclusive, and that includes these types of assessments that can be actually very costly out of pocket. Sometimes they go up to about $1,000, $2,000 for the full panel of neuropsychology assessments. So that's one part, is just the coverage of the actual, let's say, benefit plans for services that are really not easily available through the public system. And then also having EAP systems, for example, that know how to navigate the healthcare system and how to support people. So not everything is just getting an assessment. It's also, how do we support people that do have a diagnosis? Let's say people are struggling with social anxiety relating to having to go back to work in person because they're neurodiverse, or they're having, difficulty struggling with time management. And so it's just making sure that different programs have these people that are there to support. And it's not just psychologists and neuropsychologists. You've got occupational therapists, you've got, for kids too, you've got the psychoeducators, you've got speech language therapists. There's a lot more of a wider variety of different professionals, and also just making sure that the benefit plans for each organizations have a wide enough coverage in order to allow people to find the care that they need at different levels.
Dave or Heidi, have either of your organizations taken on some of these approaches in your benefits plans?
Yeah, and honestly, Dr. Stephanie made some amazing points. I think the access, the cost, all of that becomes significant barriers. And we have, again, and I know I've mentioned it earlier, by doing the benefit surveys, those help us identify areas that we need to address, things that we may not have been aware of that employees are interested in. So we haven't had to implement anything, any of these particular services within the organization, but I hope that we are doing the right thing by constantly asking the questions. And then honestly, I reach out to Dialogue when we have a unique case or there's something that's not offered in, our overall health benefits. I'll reach out to our account manager and say, look, is this something that you offer? If not, can you point me in the right direction? Like we would like to talk to a specialist, or we would like to talk to. So we don't have it in place, but I think it's a great point to say that the cost and accessibility is a challenge, but I think it's also really ensuring that your employees know, again, that it's a safe space to come and ask those questions, and then we can go and try and get that information for them.
Perfect. Just another question here from Lauren, and Dave, I'll point this at you first, but you hit on wellness challenges in your one of your answers previously, and maybe you can expand on some others. But what are some of the health and wellness initiatives that you've implemented inside your organization, obviously outside of an EAP, that you found beneficial?
I'd like to think we have a number of arrows in our quiver to try to help people, because it's not a one size fits all, as we know. Certainly, I'll kudos to our guests today of Dialogue. We've used that for all of our associate population across the country and given them access to that. We have an EAP system. We have an online cognitive behavioral therapy organization that we tie people into. But one of the most successful things that I think we've done, and again, we don't want financial reasons to be the reason why people don't get help. So we introduced something called our mental wellness account a couple of years ago, where we pay for psychologists, social workers, counselors of all stripes, and you can get up to $3,000 a year for yourself, $3,000 for your spouse, $3,000 for each of your kids, to be able to put that towards any counseling that you may need. So therefore, you can design your own program. If you're struggling with who to contact or how to get in touch with people, we also have some really good contacts within the health sphere. Again, thanks to our guests at Dialogue and others. But I think it's giving people the maximum amount of choice of how they want to get their help has proven to be very successful for us.
Perfect. Thanks, Dave. Yeah, there's a question just popped up here, and Sylvain, maybe I'll get you to quickly hit upon this one. What are maybe some of the best HR strategies that to encourage supervisors to be more proactive with mental health, well-being, trainings, all that kind of stuff?
I think it's to be present, to understand their needs, their reality, to provide the training that they need. We've delivered some training around mental health to managers last year. We're going to target next neurodiversity training to managers, is to be part of the conversation with them, to be able to support them and to challenge them as well in terms of getting the level of education awareness that they may need. So I think it's really be part in our model in the talent and culture. The business partner model is one that's working very well, is to have partners every day supporting the needs of our managers and provide the right tools and guidance around that.
Perfect. Well, with that, to say that this is a journey. And like you just said, Sylvain, it's so personal for every individual, whether you be employee, manager, or whatnot. And so, making sure the choice is there, the modality of supports are there throughout the organization will be important. Thank you, everybody, for joining today. And thanks to our speakers. That was a great conversation. And thank you for your time and contribution with this. Very, very important and eye-opening conversation. So thank you, everybody, for that. Have a great day, everyone.
Thank you, everyone.
We'll chat again soon.
Thank you. Take care.